Mrs. Kumari, a case of short bowel syndrome was inserted this catheter. What is the best vein to insert this catheter? See, because this is a case of short bowel syndrome, I am going to give nutrition by giving this central vein catheter. Please don't forget, this is a central line catheter. Central line catheter, 3 lumen type. This is 3 lumen type central line catheter. So we can put this central line catheter in 3 places. Subclavian vein, internal jugular vein, or femoral vein. Only 3 places I will put. Don't forget this. So internal jugular vein, femoral vein, subclavian vein. These are the 3 veins I put the central line. In this patient, short bowel syndrome, I am going to put this for feeding purpose. Feeding of TPN, total parenteral nutrition, I am going to give via this central catheter. So in a patient who is going to have this central catheter for a long term, which is best? Short bowel syndrome, no? So patient will be having this for long term. See, all of you are wrong. It is not the internal jugular vein. Please don't forget, there is a very important catch point here. Please understand the anatomy. You will never have this doubt. This is a picture of a patient I am drawing now to show you the central vein anatomy. See, this is a clavicle, and don't forget, this is internal jugular vein. This is subclavian vein. Internal jugular vein is easy. You can put it just like that here. Okay, you can easily put the central line in this place just like that here. But subclavian vein will be a little difficult. Nowadays, people use subclavian vein catheterization under ultrasound guidance. Usually, people use it by ultrasound guidance. This is IJV. Easily, an surgeon can put the IJV by just turning the patient to the opposite side between the 2 heads of sternocleidomastoid. So, subclavian IJV. 2 methods. Between the 2 heads of sternocleidomastoid, you can put like this. It will go to IJV. Subclavian below the mid-clavicular point. And there is another place that is in the femoral vein. There also you can put, in the femoral vein also, you can put the central vein catheter. So each one has one MCQ. This is femoral vein, which is comfortable for the patient, which when you put, the patient will have no disturbance. Yes, subclavian vein is easy. See, I can put the shirt like this and go for my work, putting the subclavian vein. Subclavian vein is ideal for long term. Please don't forget, long term subclavian vein is ideal. In long term, for giving nutrition, subclavian vein is ideal. IJV is best for short term. Only for short term, I should use IJV. For trauma patients, I will use IJV. So only 2 we use, subclavian or IJV. Femoral vein we rarely use. The femoral vein has high risk of infection. That is MCQ. Highest risk of infection is seen with femoral vein. So short-term IJV, long-term subclavian vein. So the answer, best answer is subclavian vein in this question. Please don't forget, because the question is having a clue. Short bowel syndrome patient, not a trauma patient. If the patient was having a question of trauma, I would have gone with the internal jugular vein. This is a nutrition going to be given for the short bowel syndrome. Therefore, subclavian vein is best. So there is another simple basic question. Which among these 3 veins will have more chances of tension pneumothorax? Can you tell me which is having high chances of tension pneumothorax? Subclavian vein has highest incidence of tension pneumothorax. Okay, highest incidence of tension pneumothorax is with subclavian vein. Okay, we can injure the lungs by putting the cannula. Therefore, when you put a subclavian vein, always you must take a chest X-ray to look for any pneumothorax. Don't forget this. I should take a chest X-ray to look for pneumothorax. Don't forget this. Subclavian vein has the highest incidence of pneumothorax. Okay, don't forget this point.